Thank you guys for coming back. Hi, Julius. Hey, Jules. Thank you so much. Thank you so much for coming back as we look at the issue of the, hey Julius, the Vag-jay-jay. You see, whole heap we have it, and we don't know what we have. You hear about the good bring life and the turn up. You must know. Thank you, Julius. You must know so you think, things are going and you have to take care of it. Just like how you got to do your hair and your nails, you have to make sure so the vagina is taken. Dr. Robin here. And you see, because we're asking, there's so many things that we're asking. Um, Change them regularly, how comfortable. So I hope by now you have an idea in terms of, your undies and, how you wear them. Me not agree with the thing with them talk about the 6 months thing, because me not see myself I change panties changes in throw panties every 6 months. Me not really see that. But at least you can learn a thing or two. I've always heard that you must put it up in the sun, put up the crotch in the sun so it gets sun. So I guess you continue. According to Dr. Robin, yes, she agrees with that. So you continue doing that to ensure that all is well. She says yeasting is a no-no. She doesn't recommend that, and we've heard that it dries out the vagina. So you don't want to do that. The vagina is self-cleaning. So, you allow it to clean itself. All right, I'm going to get back now. I'm going to rejoin Dr. Robin. Okay. She's coming back on. Dr. Robin.
Hi.
I must tell you, I really appreciate you taking the time out. I really appreciate you taking the time out to come and speak. If persons want to talk to you, to, come and have a consultation with you, because, I guess people want to know you first and feel comfortable with you and then come and continue the conversation. How can they get in touch with you? And I know that you have your very informative IG page. I must tell you, I've been going to that page. So just tell them about your IG page and how they can get in touch with you.
So my Instagram page is Dr. as in Dr. Robin Kemlani, and my contact number is.
Hold on, Janelle, can you just write that in so I can put it up? Say it again.
Dr. Robin Kemlani.
And it's ROBYN.
YN, right?
KHEM.
LANI. And my phone number is 876 428 6427.
All right, so we'll put that information up again, just in case, because persons are really afraid to talk about this issue. You have to ensure that the person you're going to is somebody that you're comfortable to share your most intimate information with. So you have to find that person who makes you comfortable. Because you've had persons who visit your office who lie, right?
Yes.
Because they feel that yes. Yeah. So somebody's asking for you to repeat the number. Oh, hold on. Let me see if Janelle has put it up. 1 second. Oh, they're asking you to just repeat your contact information one more time for me, please.
876 428 6427.
And your IG page is Dr. ROBYN KHEM LANI, right?
Right.
Right. So, if you want to continue this conversation, and we can continue. So, before I go on, I have a list of questions for you, but I haven't even touched it because they have so many questions here. So, you have the issue of we talk about the douching already, which is a no-no. We talk about the pubic hair where you're saying you recommend waxing, and if you're gonna leave some on, you will just trim it.
Yeah. So for pubic hair, as I said, you really should keep some, but that's a thing that I'm willing to compromise on in terms of, yes, keeping it has benefits, but I also understand that you may want to remove some. So if you're gonna remove, then wax.
All right. So there's this also thing about check the lube ingredients. So some persons use lubricant, but
Right.
that also can affect their vaginal health. Can you explain?
So you should not use anything that's oil based or petroleum jelly based. Again, those are things that are going to disrupt the good bacteria in the vagina. So when you use a lubricant, it should be water based.
Okay. Use good, safe. By the way, sex toys. What's your position on the sex toys? Because I'm seeing here where it's saying you have to use safe sex toys, or that can also affect your vaginal health.
Yeah, because I think that has a lot to do with, well, two things in particular. Moving from anal to vagina, vagina to anal. So in terms of the transmission of bacteria, in particular, I had mentioned something like E. coli moving from the anus to the front. And two, you have to clean them properly. Have to. And you cannot share them. If they're yours, they're yours. And in terms of cleaning, usually I know that they're made of different materials, so you should read the label that it comes with, but most of them you can clean with like a mild antibacterial soap and water.
All right,
so definitely clean after use.
All right. Someone was asking about the issue of the herpes. We were talking about the 1 versus 2 that you were making a point about it.
I was saying that I was starting to say that the shedding of the virus is higher when you have the active sores or lesions, and that's when it's more likely to be transmitted. But I wanted to make a point to say that just because somebody doesn't have an active lesion or an active sore on the mouth or in the vaginal area, men on their penis, it does not mean that the virus cannot not be transmitted. So just because somebody does not have an active lesion does not mean that the virus is not shedding and that the virus cannot be transmitted. It still can be, which is why when you have herpes, the truth is it's something that you should share with your partner.
How common is it?
Very common. After the HPV virus is probably the most common sexually transmitted infection, and a lot of people have it, men and women, and they don't know that they have it.
Oh, really?
Yeah, a lot of
so
people.
That's the issue, because if you don't know that you have it, you can share it with your partner unknowingly.
Exactly right.
All right. Oh, this was saying practice safer sex. So the multiple partners and the threesome, foursome, what's your take?
So yes, and I mean, I know that men are listening too, but for women, I guess I probably should point out some very important information about why you should practice safe sex. So you need to use a condom, and you need to stick to one partner. You should try to be in a monogamous relationship. If it is that you are in a relationship though with one partner, you should still do testing for sexually transmitted infections at least once per year. So as long as you're sexually active, you need to get tested for STIs at least once per year. Why particularly in women? Because you have to remember that some of these infections can actually affect your fertility. So things like chlamydia and gonorrhea, sometimes there's no specific hallmark, when you come to the doctor and you have an abnormal discharge, there's no hallmark to say, this is chlamydia or, this is gonorrhea. There's nothing that we can see. I mean, sometimes if you do have an infection like pelvic inflammatory disease, then yes, on examination, we'll find specific things. But you need to get tested and you need to know, because things like that can scar up your tubes, and it can cause you to get things like ectopic pregnancies when you're ready to get pregnant, or it can actually just cause infertility because it can scar your tubes. And I mean, that's not something that you'd want for yourself later on in life. So you may be sexually active now and you don't necessarily want to have a child now, but you don't want that later on in life. You're ready to get pregnant and you unfortunately have like an ectopic pregnancy, or you just have infertility because of scarred tubes.
So there's this question now, two questions. Can the herpes be transferred to the baby? Can babies be born with herpes? And do you always have a breakout when you have the herpes?
All right, so the first question is yes, it can be transmitted to the baby. So usually when somebody who has herpes, even prior to pregnancy, we do start you on medication once you get to 36 weeks gestational age. And the point of that medication is to reduce the chance of transmission to the baby, in terms of trying to reduce the chance of you having an active flare. So once you have active lesions in pregnancy at the time of delivery, then yes, the chance of transmission to the baby is higher, because then the baby will be coming down into the same passage where the lesions are. So we give you that medication to try and reduce the risk of you getting an outbreak or a flare of the lesions coming up, when you're 39 weeks and you're ready to give birth. With that said, even though we give you that, there is a still, and even without the lesions, I should say, there is still a smaller risk of transmission of herpes to the baby, even if there are no lesions. But the risk is higher if you have lesions.
So there's another question now about when there's a breakout, if there'll be any sign. Let me just go back to that question. Okay, do you always get breakout with herpes?
No. So as I said, some people can have herpes and they cannot know that they have it. The first time somebody can know that they have herpes is that they can get an outbreak. So the specific classical appearance of it, these bumps that come up and they kind of burst and then they crust over, and it's usually multiple of them. So they can either present like that, or you can just go and do your testing for it, random testing or testing you're doing because you're sexually active, and it can come back positive.
So will the herpes make the baby blind?
If it no, it doesn't really make the baby blind, but it can affect their eyes, their skin, their eyes, right? But no, not blindness.
Okay. So you mentioned the thing of peeing after sex, and
Right.
it's one of the things that came up as a good way to ensure that your vagina is healthy, because by peeing you actually wash out any bad bacteria. Can you just reiterate that point?
Well, the truth is, when you pee, you're not necessarily washing out the bacteria from the vagina. You're washing out the bacteria or any kind of sweat or lubricants, specifically from the urethra. So the urethra is the area where the urine comes from, and it's a little tiny hole above the vagina itself. So peeing after sex will help prevent a urinary tract infection, because you're flushing all of those things out from the tip of the urethra. So you're kind of preventing it from ascending upward into the bladder.
Okay. Okay. So that's peeing. And of course, we mentioned the issue of sleeping in your birthday suit, because it makes you sleep better. Right?
Definitely.
Dr. Robin? So I see where they're saying it's a good program. I want to have you back one day soon, because I want to talk about the issue of sex in general, because it's an issue that people just born and then just grow up and then just drop in it. If you understand what I'm saying. They don't know all of the A's and the B's about that issue. And I'd love to come back and talk to you. Right now, the society that we're in, the society that we're in, we are all over the place in terms of freaky deakies, doing all kinds of things. And we need to know what is good for you and what is not. Don't you think?
Yes, I agree.
Okay, I have one question for Dr. Robin. Go ahead, because I really want to thank you for coming on, Dr. Robin Kimlani. You've been awesome in terms of your information. Go ahead with the question. I don't know if you'll be on still after we have, because I have Nicola who's going to come on to talk about the waxing. But I wanted to know, when is it suitable to wear panty shield, since we shouldn't wear it every day?
So around the time of your period, so on the day that your period starts, and it's not that heavy, and you want to have something there, and it's at the end of the period, when the period is again ending, and it's kind of just doing the spotting, but it's not enough that you may necessarily need to wear a pad. So you put on a liner.
Okay. Yeah. So you agree though, we need to have a conversation about sex and educating the ladies and the gents about the do's and the don'ts, right?
Right.
Okay. And putting you on the spot here, will we get you back here to talk about that issue?
Yeah, man.
Guys, I was telling Dr. Robin was a little nervous about coming out. I said, listen, you see, this is something that everybody want to talk about. This one, my vagina keeps itching, and I went to the doctor, got medication, but it won't go away. I'm not sure what to do.
Oh, but I mean, the truth is there are different causes of itching, and if it is that the person was treating you for a yeast infection and it's a recurrent infection, there are other things that person may want to test you for. So they may want to look at your risk factors, talk to you about to see what you're doing wrong, to see if we can change it, test you for diabetes. In that situation, if you do have those kind of recurrent infections, we do encourage you to get tested for like HIV and do your STI testing, just to make sure it's not anything else, and we're simply treating you for a yeast infection. And I know you're trying to end, but on that point, on just one last thing, which is probably like the most important thing that I'm probably gonna say today. If it is that you're having a recurrent infection, recurrent odor, itching, and it's just keep coming and going, and you keep getting medication and it's not getting better, please to make sure that you have a pap smear done to make sure that this is not a precancerous lesion or that is cervical cancer, because one of the ways that cervical cancer presents itself is with a recurrent discharge from the vagina. That's usually refractory, or the patient is getting all these antibiotics, medication, and it's just not going away. So
Dr.
yes.
Robin, I hear somebody said best gynecologist around town. That's you.
Oh.
Yes, and Anya is saying best gynecologist around town. Check out her page. Yeah. So guys, remember, she has a lot of information on her page. She's giving it out there, so you can just go and look through, and you'll see all that you need to know. And then whatever it is that you don't know, they're asking, do you need to make an appointment to see you, or can they just come in?
No, right now, especially since COVID and stuff, it's better to have an appointment.
All right. Dr. Robin, you are amazing.
Oh, thank you. Much appreciated.
Hold on, there's another question. It can also be her partner causing it. Somebody was asking, how would they know that they have herpes if they're not seeing any kind of lesion or anything like that?
The testing, the herpes.
So you recommend that when they're doing it, they go and get tested for everything?
Yeah, man. Well, yeah, you're supposed to. Once you're sexually active, it's recommended that you go and you get tested for all the sexually transmitted infections. The most common ones, at least the most common ones. So that's the HIV, your syphilis, your herpes, chlamydia, gonorrhea, trichomonas. So yeah, that's how they would know, by doing the testing.
All right. So this question: what if someone keeps having a lump? What is this? Swelling, bumps under the mons pube. What is that? You can tell me what that definition is. What do you think?
The mons is the fatty part of the vulva. Basically, the part that they. No, man, the mons is the top part. Basically, where the majority of the hair is, and then it comes down into the labia majora and minora. But the mons is basically the top part.
Dr. Robin, look here now. When you talk about labia, I'm wondering which part it means so. So I know the lips and the black. Tell me in the layman terms that you're talking about, no?
So basically, this entire part, the entire thing is called the vulva, right? That's the word that encompasses everything. So the top part where the hair, most of the hair is called the mons pubis, and then coming down the fatty hairy parts, the fatty lips, the outer lips is the labia majora, and then the thinner part, the thinner inner lips, that's usually it is hairless, is called the labia minora, and then
That's
once
the
you
clit?
part,
That's the
no
part they call the
man,
clit?
no man, we don't reach there yet,
You
and
see,
then once
you
the
see? And I should know about my vagina, don't my God.
So once you part the labia minora now, that's when you can see the clitoris, the urethra, and the little vagina, the vaginal
Okay.
opening.
Okay. Any more questions? Dr. Robin, I mean, you can speak all night. Is there any other takeaways that you wanna have, you wanna say?
Um, no, I think I said everything. I mean, just remember your pap smears, please. Pap smears. We need to reduce the rate of cervical cancer still. So pap smears and HPV vaccine, please.
Okay, so this other question now. Can oral sex give the vagina yeast infection? After all, isn't the vagina cleaner than the mouth?
No, because I would no, because the yeast typically is not sexually transmitted. So yeast infections have always been categorized as infections that are not sexually transmitted at all. So no.
Okay.
But as I said, if you have an active infection, then you would not want to have sex or any kind of form of sex because then it would make things worse.
Okay. So somebody say you haven't answered it, hon. And when you
And
say hon, you're referring to who?
and
Why does discharge burn out? Oh, I know this one. Why does discharge burn out the underwear clutch? Because it's the acidic color,
ah,
right?
yes,
You
yes,
know, we
yes,
know
yes,
something.
yes.
Yeah.
It's the lactic acid in the normal kind of discharge and stuff. So especially like when you wash it and hang it out, because of oxidation, it can just it can leave that bleached appearance.
How often do you recommend the packs?
So right now, we still are doing them every year, yearly in we're if every year. So depending on, I mean, the guideline that you do look at in America, some they do them every 3 years, but you can't compare somewhere like America, who has been very aggressive with their HPV vaccine and have different cervical cancer rates than us here in Jamaica. So no, you need to still do them yearly.
Can a UTI be sexually transmitted?
No.
Never heard about trichomonia.
Oh, I had mentioned that as one of the sexually transmitted infections.
Okay. How often do we visit our gyno? Because you
I
know
would
some
say
people just come when things get bad down there and
wrong.
they can't do it
Yeah,
together. Yeah. How often do
no.
we visit you?
I should at
Hi,
least get
Nisha.
at least once a year because at that time, you'd get an overall checkup, you'd be doing your pap smear, you'd probably getting the request or the paper to go and do your STI testing at the lab. Any kind of issues that you have with your period can be sorted out. A pelvic exam can be done for you. You can see if you feel any masses in the tummy, and if you do have that, you can go and get your ultrasound done. So at least once for the year, at least.
So they say you haven't answered the question about the swelling and the lumps.
Oh. Wait.
All right, can you just put back that question because it's going so fast? Just put back the question so we can get it out there. And can herpes be cured?
No, unfortunately, once you have herpes, it basically lives or stays in your body. There are some specific kind of cells, called dorsal root ganglion cells that the herpes virus lives in. Every now and again, you'll get an outbreak. They do say that people who have a healthy immune system, they maintain a healthy lifestyle, don't have a lot of stress going on, they're less likely to really get an outbreak of the herpes. But once you have herpes, you have it for life. It's not curable. And that is the importance of one, sharing it with your partner, and two, when you are pregnant, sharing it with your OBGYN.
What causes itching after period?
So that goes back to say that usually when you have your period, I should mention that depending on how often or the lack of you changing your pad or your tampon, the menstrual blood itself, can cause a lot of moisture, and the menstrual blood itself can actually throw off the pH. So when women say they change their pads every 3 to 4 hours, that's actually not a bad idea, because at least you're not sitting down there with a pad for 8 hours and having the blood sit
Oh,
there
yeah.
and right. And then if you do have itching, you probably want to look at the brand or the type of pads or tampons that you're using as well to see if that's contributing to it.
Just to say, somebody said Cola goodly drop asleep. No, Cola is still here. She's actually enjoying this, and she's gonna join me after. But you see, because you have so many questions for Dr.
Yes.
Robin, I'm just trying to ensure that we get them in. Because the next time she's on, we're talking about a fun topic. A fun topic. Okay. Question: does fibroids make you have yeast
No.
often?
No. Definitely not, sir.
Okay, so here's the question now. What if someone keeps having lumps, swelling, bumps on the...
Oh, this is the same question.
Yeah.
So if you're having recurrent bumps in the area, I mean, I am taking this into just a general broad context, because this is not somebody that I've seen or examined or even spoken to, but you probably need to look at something just to make sure it's not a simple folliculitis, meaning hair bumps, razor bumps, making sure it's not anything sexually transmitted, that is not any enlarged lymph nodes that you're having. You can also have you have sebaceous glands and cysts in that area, so it could be something like that as well. So there are different causes for it, 3 of which I just mentioned. But that person will probably need to go to their gynecologist or gynecologist to have it seen and examined.
Okay. So, Dr. Robin, I want to thank you so much for being here. Let me just repeat her contact information. If you go to her IG page, you'll get her phone number and her location, right?
Right, that's correct.
So, her IG is Dr. ROBYN KHEMLANI, Dr. Robin Kemlani. I call her Dr. Robin because you have to give the woman a proper title. So much time she spent over 1 hour here with us tonight, telling us everything. I really appreciate it. What does inflammable cells mean?
I'm assuming this person is talking about a pap smear, an abnormal pap smear result. I'm not sure if they're talking about atypical cells or they're talking about reactive cells. They would have to tell me
they need
a
to
little
come
bit
see
more.
you. Yes, they need to come see you. Guys, you need to go see her. So, Dr. Robin, the aim of this live that I'm doing, right? I got a ring light. And I love taking pictures. And I was like, we're going to take some pictures and go on live. But then, just to go on live every week and just talk foolishness, it doesn't make no sense. But there are issues affecting us that we really can talk about. And then, because of what's happening now with COVID-19, we can get a service provider who can talk about the service, which is you, or the products. And we can link both. So it's a win-win. We talk about the issue. We're talking about it now. And then I'm linking them to you. So if you have any other questions that you want to ask Dr. Robin, you can just contact her, because, when I was reaching out to her, it was so easy. Within minutes, she was answering. So, Dr. Robin, again, I thank you, and everybody else is telling you thank you. Big up, Doc.
Oh, you're welcome. I appreciate
really
it.
Nice. You guys should give her a visit. Oh, that's somebody Glam Necessity is saying. Really nice. And they should give you a visit. Right?
Thank you.
All right, so Dr. Robin, if you don't have anything else doing in the Saturday night, if you don't have anywhere going, although curfew, you can stick around. And I'm going to have Cola on now, Nicola, who's going to talk about waxing and everything like that. So, maybe somebody will have a question there and we can get you on. But if you don't, hold on. I see 4 questions. Before I just let you go, let me see. Ask her. What can help with heavy flow? With heavy flow, been happening far too long. So somebody has an issue with heavy flow.
So heavy periods are caused by a lot of different things. They're caused by fibroids, polyps. It could be something hormonal that's causing it. So it would actually depend on the cause of what's causing the heavy period. So, even something basic like an ultrasound would be beneficial for that person to do first, to see if it's a fibroids or like polyps in the lining of the womb. And then they would know in terms of what medication to take, if it's something that you need like a surgical procedure to help with,
Okay. And then there's another one. What if someone has ovarian cysts? Do they have recurrent yeast infections?
No, again, not related.
Mhm.
Definitely not.
All right,
Mm.
Dr. Robin, thank you so much. So
You're
you promise, you know,
welcome.
so you promise us that you're coming back to talk about that other issue, right?
Yes, we'll talk off about when.
Yeah, man. Of course. I normally give them a couple days notice of what we're talking about.
Okay,
So
okay, okay.
definitely. Thank you
Okay,
so much.
okay. You're most welcome.
All right, then. Bye bye.
All
And
right.
remember, it's Dr. Robin Kenlani. Just look her up on IG, and you will get all the other information. Can cervical cancer be detected through a blood test?
No, you'd have to do the pap smear, and the pap smear is to look or to screen for pre-cancerous cells that, if they're left there over time, will develop into cancer. So that is why you do your pap smears to look to see if there's any changes going on that we can treat, and then follow up closely to make sure it doesn't progress to cancer.
All right. Thank you so much, Dr. Robin. Oh, what causes heavy clotting?
Same kind of explanation as the person with the heavy bleeding. So again, you would need basic investigations to try and find out what's happening. Is it that you have, again, fibroids? Do you have something like adenomyosis? Do you have any polyps in the lining of the womb? So there are different causes for it. You have structural and other causes.
And it should be noted that your diet has a lot to do with your vaginal health, right?
Oh yeah, for sure. So if you have a very poor diet, and you're drinking beer all the time, and you eating sugary foods and sweets and all this junk food, it will throw off your vaginal pH for sure. Yes.
Okay. All
Mm.
right. Thank you so much, Dr. Robin.
You're
All right.
welcome.
Bye bye.
Bye.
All right. So we're finished with Dr. Robin now, but I couldn't go without having Nicola. She's going to come on to talk about waxing, all right? Because she was having some technical issues earlier. Nicola, can you send me a request so I can have you up on it now? Dr. Kemlani has been my best OBGYN to date. Yeah, she was awesome. When I reached out to her, she did not have an issue coming on, and I'm really thankful. Guys, support small businesses, support Jamaican businesses. If you have an issue and you really think Dr. Kemlani can help you, just reach out to her, because as you realize, she has the information. Official Junior sent a request to be on your live. Official Junior, why you want to be on my live? Let me put him on and see what happens now. While I wait on Nicola. So while I wait on Nicola, Nicola, okay. We're waiting for you, Nicola. Connecting. Hey, hey you.
Hi.
Way better, way better. I don't know what was going on, but it's not affecting me now. So let's go right into it. So we're talking about waxing, and you have to keep the vagina nice and healthy, etc., etc. So is either you're going to trim it. Dr. Robin said no to shaving because of the bumps, and then you have the laser, but that's a couple treatment, and that's very expensive. And then voila, we have waxing. So tell me about the different
Yes.
waxing.
All right, so there are many, waxing every day. There's a new method, there's a new kind of waxing. There is the hard wax, there's sugaring, and then let me just stick with there's a traditional waxing, which is the waxing with the material, which we call calico.
Uh-huh. So the sugaring, what's the difference between the sugaring and the one with the material, the calico?
Okay, so the sugaring wax is, as it states, sugaring. So it is actually a mixture of sugar, water, and lemon, which we use. It is applied partially warm to the skin. That method, it's less painful, which I beg to disagree, because pain depends on your pain threshold and the kind of skin and the hair that you have. Versus the other wax with the calico, which is a warm wax that we put on, and you put the material on and then you rip. That one to me is more effective because that rips the hair from the roots. So versus with the sugar, where you have to be going over and over to get the hairs out, and then with the sugar, and the hairs have to be at a certain length, which will be longer, if I'll be doing the regular calico waxing.
So you
So
mentioned the issue of pain and pain threshold. On a
mhm.
scale of 1 to 10, how painful is the waxing?
Okay, so that question is a bit tricky to answer because what would be a 5% a scale? I mean, what would be a 5 for me would probably be a 10 for you. So it all boils down to what your pain threshold is. How tolerant are you to pain? Also, in terms of pain, there is a time when your body is less susceptible to pain than another time for females. So versus um, 2 weeks before, well, I would say wax 2 weeks before your period or 2 weeks after your period. Because when your period, the closer your period is to waxing, the more your body is different. So your hormones are different, your pain tolerance is lower versus when your period is further away.
2 weeks before, 2 weeks after. Cause you know when I wax because I want to walk around and be like, nah, just free and everything like that. But 2 weeks before would be okay, and 2 weeks after. That's what you're saying now in terms of it. Okay, all
Right.
right. So tell me about the different types of waxing that you do. Because I remember when I was coming to you for the first time to do it, and I should be taking baby steps. Tell me about the different types.
Okay, well, as I mentioned before, well, what I do offer sugaring. I do offer hard wax,
No, man, in terms of
and
like the
I
Brazilian, the bikini.
oh, right. So, well, I wax everywhere. So wherever hair is, apart from on your head, I wax everywhere. So I do full legs, underarms, brows, Brazilian, upper lips, buttocks, which is included into the Brazilian, your butt cheeks as well, back, chest, the works. So wherever there's hair, I'll be happy to remove it.
Oh Lord. So I was telling them that when I came to you the first time and I was on the bed, I was locking up my foot. And you're like, Dara, you came here to get a wax in. Open up, and because you don't have anything that I haven't seen before. I mean, how do you get them comfortable to do all of this now?
Yes, I repeat that for me. I didn't get the last part.
How do you get, especially for a first timer coming in, how do you get them comfortable to allow you to just remove all that hair?
Well, just like how I got you comfortable, I let you know that this is nothing new for me. I've seen like a million vaginas during my years of tenure, and my personality sells. You know, I speak to you, I get you, I speak to you about, I question you. What do you like? What do you like to do? Have you waxed before? What are you expecting? What are you not expecting? So things like that, and it works every time. It works every time. So I'm very good at distracting you from thinking that, oh my God, Nicole is going to see my vagina. This woman, the stranger, is going to be all up in my business.
All the way up. All the way up. Because I remember when I was doing the Brazilian, when you said
Mm-hmm.
turn around, and I had to turn around and like open up the butt cheek. I was like, Lord God. So this woman, I don't know if I'm Adam, so all up in my business, whatever. I mean, but it's necessary and when you do that. And do you suggest that person start off with maybe just the Brazilian, the lining of the panty? We call that one.
Bikini.
Bikini, yeah.
Bikini. For first timers, I usually recommend that you start off with a bikini if you're iffy about doing the whole thing, opening up to me, to seeing all of you, as well as the concern that you may have that it is a killer pain, because what we see on advertisements and TV, it is pretty scary. And then when you come, you realize that, oh, this is not as bad as I thought. So I usually recommend that they do a bikini just to have a feel, so it can register in the brain that, okay, this is what it feels like. But usually when they come, they usually just go right ahead with the Brazilian and say, oh, well, it stings, but it's not that bad, Nicole. So just go ahead and take everything off.
Why
But
is
then there
it
are
that
some who still just sticks with the bikini.
why is it that after you finish waxing you feel like you can run out in the road naked and be like, ah! What is it about waxing?
It, I believe that there's something about pain and females. I mean, it is not a killer pain, as you know. Nobody leaves my office dead, but it is kind of like a victory feel when you go through with the entire waxing, to know that, oh yes, I did it, and I feel so clean, I feel so relieved. It's like when you have a lot of build up in your head, in your hair, and then you finally relax your hair or you shampoo it and you feel light. So it's that feeling, and it makes the female feel much better about herself. You actually make you feel sexy. So that is why you probably don't feel like you want to wear any clothes when you leave in my office, or you don't want to wear any underwear. That's fine with me as well. So it makes you more confident.
Can you be allergic to waxing? Can you be allergic to waxing?
Some waxing. So I know that some persons are allergic to sugaring. For whatever reason, they may be on medications that counteracts with probably the acidity in the lemon that's in the waxing. Some persons are allergic to sugar, believe it or not, topically. And then there are some waxes that some persons are allergic to. So that is why I have a wide range of different type of waxes that I use on different persons. So that's why when I come in a question and say, are you allergic to this? Are you allergic to that? Have you ever had any issues doing this kind of waxing? What did they use? So yes, some persons do have allergies. For example, like swelling of the area, sometimes itching, sometimes you can get a yeast infection. It just depends on what product is being used.
Oh, you can. I don't know if you're hearing all that tick patter of the raindrops, but I love it. So here it goes. I have a male friend, you see? He is telling me that he does not like hair whatsoever. I'm digressing because this is about the female health, but I wanted to bring this in. He says he does not like hair whatsoever anywhere on his body. Do you offer waxing for the male?
Yes. I will wax a broomstick if hair is on it. Put it that way. So yes, I do offer waxing, full body waxing for the male as well. A lot of males will ask me, can you wax my beard? I have done it before, but it's not something that I recommend because one, it's very painful, and the hairs on the beard tends to be very, very thick. So it's a very tedious and lengthy and painful process. I know man can bear pain, so I don't recommend them waxing their beards if it's a thick, if their hair texture is very thick.
How do you get them comfortable though, especially when you're waxing the genital area? Is there anything that you recommend that they do to get in that comfortable space?
Well, generally no, because I'm a female. I mean, I keep my services professional, so I don't do or say or act. I don't do or say anything that would trigger thoughts or emotions. So when they come in, very professional, ask them questions, and I just work while I ask them the questions to keep their mind on what I'm actually doing.
But I know you try that, but then because you're touching, because of the touching to remove, of course, that will cause them to maybe get an erection. Am I correct?
Right,
But they
because
should feel
that is
comfortable
normal.
to know that it's normal.
It is normal because once you're being touched, you're going to be aroused, even if you're not attracted to that person. So it is normal. It is also normal for the female to get aroused because this is our private parts, which is very sensitive. This is private parts we're touching and fondling and, treating. So yes, both sexes will get aroused.
Okay. I just did something a while ago, and so if you're planning on can persons be allergic to waxing? You said that if you're planning on coming to you for waxing, what are some of the things that you need to take into consideration if you're planning to come to you to do something like that?
Okay, so a few pre-waxing measures that I always recommend is that you shower before you come, of course. Even though when you do come, I still clean you up before I proceed. So if you suffer from like ingrowns, I recommend that you do a scrub. There are many different scrubs, sugar scrubs that are safe for the vagina that you can use. I recommend that you do that the day before, not the same day, because sometimes you may scrub and then you scrub too hard to aggravate the skin, and then I can't wax you because waxing does remove a layer of the skin, right? I don't recommend that my clients trim. So if you have a forest, come with the forest. I will trim it, I will mow it, because if you trim it, you may trim it too short. The hair is too short, and then we're gonna have a problem with me waxing. I'm gonna have to go in after and do a lot of tweezing, which nobody wants that because it's painful. So you can do a scrub, shower, don't trim, and I normally recommend that you wear loose fitting clothes.
Yes.
So yes, you can wear nice seamless underwear or a bingo
Yes.
underwear. So I don't recommend a thong or a G-string or a crotchless underwear, as Doc was talking about earlier, when you're coming to wax. So it's best to wear like a dress or a skirt so that your vagina can actually breathe after waxing.
I remember when I came to you for the first time to get my waxing, you said to me, no sex. No sex tonight, Dara. No, please note that after you finish your waxing, you are aroused. You want to go and be like an animal somewhere. Why do you say no sex after waxing?
All right, so and that falls under tips after waxing. So I recommend no sex because it's best to avoid skin to skin contact. Because when you wax, when the hairs are being removed, the pores are still left open, which is prone to bacteria. So I don't recommend that you go to the beach right after, or you go into the jacuzzi, or have sex. So you should have sex the next day, not the same night. So if you plan to have sex today, it's best to wax yesterday, the latest. Right, because all of that sweating and you don't want all of that to be soaking into your pores.
Okay. All right. So you were telling us about some of the tips before. Yes.
Yes. Before wax or after?
Before.
Right. So yes, those are basically the tips before. There's nothing major that you need to do. I mean, of course, if you're having any issues down there like foul odors, fishy odor, if you're having a yeast infection, you want to go and get that checked out before. Just like how you do that before you need to go have intercourse, then you do that before you come and wax.
Okay.
So that's it. There's nothing major that you really need to do. Just come in.
And I should tell you that Nicola is also Nicola. Tell us about some of the other services that you provide, because you've done my you've done my lashes, right? You also do. Tell me about you were saying earlier. Tell me about some of the other services that you provide.
Right. So apart from full body waxing, I offer makeup for all occasions. I do weddings, video shoots, photo shoots, and so forth. I offer facial treatments as well. There are a variety of facial treatments that I do. I do microdermabrasion, deep pore cleanse, spa facial. So I have a variety, the anti-aging facials, and I also do lash extensions.
Okay.
We do body scrubs as well, but I'm not offering that currently because of my location.
Okay. So it's like a spa.
Yes, excluding the massage.
Yeah, you
So
need
it's
to get that
beauty and
too.
skincare.
Yeah.
It's in the making.
Yeah. All right. So any questions for Nicola? I'm just looking through Nicola. All of these are from.
And while you look through, I want to touch on ingrowns because I have a lot of clients who come in and majority of their issues are ingrowns. They say, Nicola, how can I get rid of this? Nicola, why is this happening? I'm waxing. Why is this happening? But there are many treatments for ingrowns that you can do prior to waxing and before as a maintenance. There are creams that you can use that are used to treat acne. For example, benzoyl peroxide. You have the 1% hydrocortisone cream, and so forth that you can use. So that those treatments would treat the ingrowns just like how we have acne on our skins with ingrowns.
All right. Let me see if I see any more questions for. I'm not seeing any more questions for you, Nicola. So if persons want to make an appointment to come, if somebody wants to, you were saying something? I'm sorry.
I'm not hearing you. You're breaking up.
Oh yeah, okay.
Not
So
sure
if
what's happening.
persons want to get in touch with you, do you just have walking appointments? How does it work?
Okay. Go ahead now.
Oh, okay. There's a delay in the thing. So if persons are interested in coming to you for waxing services or any other service, how do they get in touch with you?
Okay. Well, I am at Unit 513 West Kings House Road, Kingston 10. And my phone number is 843-1542.
Okay. Somebody saying my first experience with waxing was a blessing. I should try it again. It is. It is. Because waxing actually frees you up for at least 2 to 3 weeks. Am I correct?
Yes. Or 3 to 4,
Okay.
depending on your hair growth.
But
But
do you know?
yes, I'm happy that what's her name? I'm happy that you had a good experience, because I mean, it is very important that you actually get a wax technician who knows what they're doing, who knows how to tend to your skin and your hair type as well, and give you a recommendation as to how to take care of the area when it's being waxed.
Mhm. Yeah,
Hmm.
because you also gave me on my first try. You also gave me some things to put on, the antibacterial things that you gave to put on. All right, I just
Right.
want you to repeat your number. So, Janelle, I don't know if
Hmm.
it's still on. You can just put that information in. You bled?
Eight four.
Oh, so she's saying, Dara, I bled. I guess that was a rough one. You know, like you had a rough treatment. Why would she
But
bleed,
I mean
Nicola?
that separate and apart from that, probably that rough treatment. Once it is something that happens for first time waxers, sometimes probably a couple tries after. Once the hair is being removed, then you would have sometimes you'll have a little blood that comes up. It is natural. It's not anything that the technician did while that is happening. So it's normal to have a little bleeding when you wax.
You make them afraid. Can we hear what bleeding is like? Lord God, what one know?
No man, it is normal.
It's
Because remember,
normal.
the skin is being shocked. So
Uh-huh.
remember, a lot of hairs are being pulled from the skin. So once it's being pulled, then
Uh-huh.
automatically some blood will come up.
So I
But it
guess
doesn't
some
happen
people
all the
skin
time.
tough. Because I don't remember any kind of bleeding at all. I guess it depends on how soft or how hard your skin is.
Of course, and the hair as well. Yes.
Mm. Somebody said, yeah, when I wax, oh my. As I was saying, yeah, oh my. It's like,
Yes.
yeah, it
Yes.
gives
It
that
is. It
feeling.
is. It
Yeah,
is indeed a wonderful feeling when you wax.
yeah.
And I always say, once you wax, you don't go back,
You
because you
don't
don't
go
want to
back.
wax.
Yeah.
You don't go back because
Okay. Okay, you say not hot so. Okay. Let me get another question in while I wait. Okay. So we're having some issues with the connectivity right here, Nicola. Um, information, and you can go on and you can check her out, and you can get your waxing services done. And this is not just for the females, but males can also get involved and get it done. Candy, yes, it's hot. Me not tell you lie, it's hot the first time, but after that, because the hair, I guess the hair gets thinner every time you do it. So after a while, they're probably calling her already. Oh, yeah. So after a while, the hair gets thin. Oh, she's coming back. And it gets better. It gets better as you go along. I should ask Nicola though, when she comes back, how long does it take? Let me, Nicola. So when you start waxing, right? when does it become bearable in terms of after how many sessions? All right, so we're definitely having some issues with Nicola and her internet service. But guys, thank you. Thank you. This is week number 3 for me in terms of doing this, and I am so appreciative of everybody. I mean, tonight is a Saturday night. I take the time out to be here with me. I thank you so much. I hope that you have learned something or you've learned some things from tonight. And of course, next week we'll be right back here looking at different issues. Nicola is coming back, so let's try one more time. Let's see. Yeah, next week we'll be looking at another issue. I don't know what it is yet, but if you have any suggestions, yes, Nicola,
I'm not sure what's happening here.
This internet won't let us be great. But I just want one quick question before we wrap up. If somebody is interested in how long does it take for it to become like the pain to not be unbearable anymore? Like, you know, because I was saying after a while it gets thin, the hair gets thinner, right? And tell us about that.
Okay, so there's not a specific amount of time that you need to have a wax session to know that, okay, it's not going to hurt this bad. So for different persons, it varies. I mean, once the hair is being removed, you're going to definitely feel this thing. But like a three sessions, and they're like, okay, because it's mentally registered, so you know that's what it feels like. For some persons, it just never happens because they have not positioned their mental state to accept that, okay, this is what it is, this is what it feels
okay,
like.
Nicola, we're having some issues again with your internet. So thank you, Alex. I thank you guys. Thank you all. I'm happy that you enjoyed it. If you are here, Alex, when next you come to Jamaica, you need to go check her out. If you are here and you need to go do waxing or any other of her services, please go and check her out. Go on her IG page. Let me put up the information again. It's Cola's Beauty. That's her thing. Cola's Beauty and Skincare. So you can go and check her out, and she'll have everything for you. She'll really walk you through the process, because you know you need to ensure that you're nice and clean and everything down there. So thank you all very much. I hope to see you all next week. You can inbox me and make suggestions about topics that you think we can cover, because you know it's a conversation. It's a conversation that we're having, and while we're doing a conversation, it's okay, Cola. It's okay. We understand that it's a signal, the internet not going so well. But guys, message me. If you have a topic that you want me to talk about, let me know so we can get the relevant persons or the relevant service provider, you know, and we can get them on. Thank you so much for being a part of the vagina session. The Vag, yes, Cola Beauty and Skincare. Put your number, Nicola. Put your number in the comments so we get it quick. Because I have 1 minute and 55 seconds before I'm kicked off IG Live. But yeah, we're moving on from the Vag next week. I'm not a Vag expert. I don't want them to think it's a Vag session. So we can talk about something else, you know? So just message me and let's talk. Have a good evening. Let's go party in the yard, of course, because you know it's a curfew time. Take care, guys. Thank you so much.